Received an interesting question along with some photographs that I'm going to describe, but I'm not going to show here. Somebody that had a vaginal gynecologic procedure of some type, it is not specified, and has never had any vaginal births. But after the procedure, they are saying that their vaginal canal has been completely changed and the perineum has changed and everything feels blocked. Can surgery fix this? They're also describing bowel and bladder issues without specifying, as well as some numbness. That is an interesting question, and I think we should touch on it for a minute here. In a case like this, the photographs were actually very close up. They don't really show any scarring, and it's hard to tell what we mean by things are blocked. In a case like this really has to be done with an in-person evaluation. A full history has to be taken as to what happened up to the surgery itself, then what kind of surgery was done, and sometimes patients, not their fault, they may not know what exactly was done. So this is one of these cases where getting the past records actually is quite important, because we want to know what was done, at least what was dictated as being done by the previous surgeon. And then, of course, there has to be an examination so that we can have some objective information as to what is happening. From there, we can formulate a plan as to what, if anything, should be done to improve the situation. And again, depending on the timing of the surgery, there may be non-operative things that can be undertaken to try to improve the situation. In this case, there was very little details given about when the surgery had been done, and of course, as I had mentioned, not a lot about what actually had been done. So it is a good question, and when people have this kind of problem, the question was asked, what kind of doctor do you go see? Another great question. The answer is, it depends on the experience of the surgeon in these different fields. It could be a urogynecologist, it could be a gynecologist, and it can be a plastic surgeon that has a subspecialty in pelvic reconstruction, and I'm in that latter category. In cases like this, it's good to seek out the opinion of one of those types of professionals. You may have to call the office and ask, do they do this kind of thing? Because some gynecologists don't get into the complicated reoperative realm of procedures, and others do. And plastic surgeons may not. You may have to ask them. So if you see that information that they do that type of work, call the office, set up an appointment, and you got to be seen in person. This is not one of the things where we do something over the phone and you come in and have the surgery. You really have to be seen in person, because there are a lot of different things that are possible depending on what is found, and we don't expect you to be able to describe it in great detail, because it is complicated from the patient's perspective as well. So I hope that helps sort out the issue of complicated vaginal reconstruction, secondary procedure type inquiries. Any questions for me personally, you can submit it to our website. And again, thank you for the question, and we will talk to you next time.